Okay guys, Timmy coming at you here, and today I'm going to go over with you cardiogenic shock. Cardiogenic shock, as the name implies, means that the heart itself fails as a pump, and in particular, the left ventricle fails. If we do a quick review, remember that all the veins of the body dump their venous blood into the right side of the heart. And then the right side of the heart sends that deoxygenated blood, that venous blood, to the lungs to get oxygenated. And then all that newly oxygenated blood comes back to the left heart, and then it is sent out to the cells of the body. So a couple of other things you need to know. The right and left side of the heart pump exactly the same amount of blood, but they do so under very different pressures. So when you look at the right side of the heart systolic and diastolic is 25/15, roughly. The left side of the heart, systolic and diastolic, is 120/80. So the systolic and diastolic pressure on the left side of the heart is about 5 times greater than that of the right side. Even though they pump the same amount of blood, they do so under different pressures. And again, it makes sense. Look, where does the left side of the heart have to pump the blood to? It's got to pump the blood to the whole body. Where does the right side have to pump to? Just the lungs. So even though they pump the same amount of blood, they do so under different pressures. So watch, and it's real simple. If you got your left heart here, and your left heart begins to fail, meaning that the amount of blood coming back to it, the left heart can't pump to the body. Where's that blood going to back up into? Well, it's going to back up into the left atria, then it's going to back up into the pulmonary veins, and as you can see from this lovely little diagram or video that I ripped off from the internet, these little vessels get smaller and smaller until they terminate at pulmonary capillaries. So the pulmonary capillaries are one cell membrane thick, and every pulmonary capillary, you're not going to believe this, is associated with an alveoli. That's the air sac. So if that blood is backing up because that left ventricle's failing, then the pressure, the capillary fluid pressure, remember your anatomy and physiology days, that's going to increase in the pulmonary capillaries. And that will literally force water from the plasma of the blood into the alveoli. And if you got water in your alveoli, then you cannot exchange oxygen and carbon dioxide. And when you get fluid in the alveoli, you have pulmonary edema. So, real simple. Left-sided failure, blood backs up into the lungs. Right-sided failure, where did the blood come from? Came from the body. So that will result in edema. And because watch, most of us are upright during the day, right? At least based on your profession. All that fluid will settle in the lower extremities, so your legs get swollen. So, and left-sided heart failure can cause right-sided heart failure because that blood will start backing up and start pushing and making it more difficult for the right heart to push that blood. So in people with end-stage CHF, that's usually what happens. So that was a quick review of the circulation of blood through the heart, which if you're in nursing school, you should know intimately. Now, let's talk about cardiogenic shock. First of all, you got to know the definition of shock. Shock, by the simplest of definitions, is the inability to maintain oxygenated blood to your brain and vital organs. So if you can't maintain blood flow to your brain and vital organs, you are in shock. In this case, what causes it? It's the failure of the left ventricle as a pump. And if the heart fails and it produces shock, that's cardiogenic shock. So it originates in the heart. Cardiogenic originates. And in the strictest of medical definitions, it goes by what's called mean arterial blood pressure. And mean arterial blood pressure is 2 times the diastolic pressure plus your systolic blood pressure divided by 3. Now, the reason it's 2 times your diastolic pressure plus your systolic pressure divided by 3, that for the most part, the heart remains in diastole 2/3 of the time. So that's how they calculate it. And if you have a mean arterial blood pressure of less than 60 millimeters of mercury, you are by definition in shock. And in this case, it was caused by your left ventricle failing as a pump. Now, let me give you an example. Guy comes in, he ain't looking so good, right? He's unconscious, blood pressure 70/30. Do the math. 2 times 30 is 60, plus 70 is 130 divided by 3. This dude's mean arterial blood pressure is a little over 40, like 42, 43 millimeters of mercury. So this guy is in shock. Just saw him. You really don't know what's causing it. So you got to figure out why. Now, the goal of the cardiovascular system is to, you better write this down, maintain blood flow. Maintain Q. So in the hospital, when you see Q, you are looking at perfusion, blood flow. And for a normal adult, the average adult pumps about 5,000 mLs or cc's per minute. Now, do we pump all 5,000 cc's at once? Nope, we don't. We pump a little bit over that entire minute. That's how you are able to achieve a blood flow. So this is important. So cardiac output, the amount of blood pumped by the left ventricle each minute. Cardiac output is equivalent to your heart rate, or the number of times that little left ventricle contracts, times the amount of blood that the left ventricle pushes out with each beat, and that's your stroke volume. So if you take your heart rate times the amount of blood ejected with each contraction of your left ventricle, that will give you your cardiac output. Now, we said that on average, the average adult pumps about 5,000 cc's per minute. And that is accomplished by your left ventricle contracting a certain number of times. That's your heart rate. And we learned that about, on average, the left ventricle contracts about 70 beats per minute. So that's your pulse, right? You feel somebody's pulse. That's the number of times the left ventricle is contracting. Times the amount of blood pumped out with each beat of the heart. And the normal stroke volume is about 70 cc's per beat. So if you take 70 beats per minute, that's your heart rate. Multiply that by the amount of blood ejected with each beat of the heart, your stroke volume. That comes out to approximately 5,000 cc's per minute, right? 4,900 cc's per minute. So that's how you get that oxygenated blood to the cells of your body. So, and again, the cardiovascular system has to maintain blood flow. If it doesn't, bad things happen, like you go into shock. So if your stroke volume goes down, or the amount of blood that's ejected with each beat of the left ventricle goes down because you had a grabber, you had a heart attack, so that left ventricle ain't contracting so good, if that drops, then you have to have a corresponding increase in your heart rate to try to maintain that cardiac output. So, and anytime you lack blood flow to your brain, anytime you lack blood flow to your brain, that is going to stimulate the sympathetic nervous system. Right? Something's going on. You ain't got blood flow to your brain. That's alarming. You should write that down. And that's going to stimulate the sympathetic nervous system. And the sympathetic nervous system is going to do a couple of things. One of the most important things that it does is that it tries to maintain blood flow. Blood flow. Come on, I can do this. To your brain and vital organs. Right? Not your brain, your brain. And vital organs, right? It makes sense. You can live without your arm or leg or toes or ears or nose, but you can't live without your liver. You should definitely write this down. If the word has live in it, you need it. So the function of the sympathetic nervous system, please get this. The function of the sympathetic nervous system is to divert blood flow away from the non-essential parts of your body and make sure that your brain and your vital organs are being supplied. So when someone's going into shock, in this case, the left ventricle is failing as a pump. In the initial stages of shock, the sympathetic nervous system is going to kick in and try to maintain blood flow to your brain and vital organs. So what produces your pulse? Your pulse is produced by your left ventricle contracting and developing a pressure to push that blood to the cells of the body. But if that left ventricle is failing, you are going to get sympathetic stimulation. This is important. And when you get sympathetic stimulation, it is going to cause massive arterial vasoconstriction. Now we know this, and you should know this. Sound like one of your nursing instructors, huh? You should know this. Arteries are basically big tubes of muscle. So this little lumen, that's where the arterial blood's flowing. So what will happen is, under sympathetic stimulation, it's going to cause all of the arteries in the non-essential parts of your body, right? Arrows, right? Arms, legs, skin, and it's going to cause all of those arteries to massively constrict. And then it will dilate the arteries to the most critical parts of your body. That is your brain and your vital organs. So the arteries to the non-essential parts of your body are going to be constricted, but the arteries to the essential parts are going to be dilated. And know this, arteries that have small diameter, they have increased resistance, and arteries that have large diameter, they have decreased resistance. So when that little left ventricle contracts and is trying to send as much oxygenated blood as it can to the body, the vast majority of that oxygenated blood is going to take the path of least resistance, just like people, right? So the vast majority of that blood is going to try to go to your brain and vital organs, and it will be shunted, moved away from the non-essential parts of your body. And it makes perfect sense. So the body's trying to compensate for the left ventricle failing as a pump. So what's it going to do? It's going to make sure what blood it can send, it is going to send it to the most essential parts of your body. So what is the person going to look like as they're going into shock and are in shock? Well, first of all, they're going to have low blood pressure. And if the cause of the shock, the cardiogenic shock, is like, say, an MI, then the left ventricle is not going to be able to push out as much blood, so their stroke volume is going to drop. So that will stimulate the sympathetic nervous system, right? And that's going to cause an increase in heart rate. So they will be tachy. Now, if you can't pump out enough blood with oxygen, you're going to have a decrease in O2 delivery to the cells. So your oxygen saturation of a red blood cell is going to drop. So when you put the little clippy thing on your finger, I know you're not supposed to put it on your thumb, but you put the little clippy thing on the finger and then it reads it out, should be between 96 to 98%. In this case, it may be in the 70s. That's really not the best measure, because you really don't know how much oxygen is going to the brain and vital organs, because all of your arteries that carry that nice warm oxygenated blood are under the effects of sympathetic stimulation and are being cut off. But you're going to use it anyways, at least temporarily. And if you're not sending enough oxygen to the cells of the body, that means that those cells are building up carbon dioxide. And when you build up carbon dioxide, that is going to cause an increase in the respiratory rate. So these people will be breathing fast. Their extremities are going to be pale, cold, clammy. They're clammy because sympathetic stimulation causes the release of our buddy, our pal, that most wonderful hormone to ever live, epinephrine, right? That's going to stimulate sweat glands. Their nail beds are going to be blue, and they are going to be in and out of consciousness. If they're out, then you know things are going down. Now look, this is the important piece. Also, your kidneys, they don't know, right? Kidneys just do kidney stuff. Those are kidneys or doorknobs. One of the things the kidneys do is they maintain long-term blood pressure. So anytime there is a drop in blood pressure with or to the kidneys, regardless of the cause. What's the cause here? We're saying that dude had an MI, so the left ventricle don't contract so good. That's going to drop blood pressure to the kidneys. When there's a drop in blood pressure, the kidney releases into the blood an enzyme called renin. You know where I'm going with this, right? And then renin takes a chemical made from the liver called angiotensin, and renin converts it to angiotensin 1. Now, angiotensin 1 is going to take arteries that were like this throughout your body, and it's going to constrict them, right? So angiotensin 1, as the name implies, angi, vessel, tension, increased tension, making it smaller. But that only lasts about 30 minutes. Then angiotensin 1, right, that goes to the lungs. So A1 is going to go to the lungs primarily. And in the lining You got a little alveoli and a little pulmonary capillary. In the lining of the pulmonary capillary, there is an enzyme called ACE. ACE, I'll get rid of this. ACE, so you got an alveoli, then you got a pulmonary capillary. I'll label these. We'll call it P-cap or P-diddy, or maybe just diddy. Anyways, in the lining of the pulmonary capillaries, there is an enzyme called ACE. It's called angiotensin converting enzyme. An angiotensin converting enzyme converts the mild angiotensin 1 into the much more powerful angiotensin 2. And angiotensin 2 takes arteries that were like this and really constricts them. Boom. So that's going to make it more difficult for that left ventricle that's already damaged to pump that blood. Now look, think about it for a minute, right? If you're a heart, right? The heart muscle. Do you want to pump blood through arteries that are this big or arteries that are this big? You want to pump them through arteries that are this big so you don't have to generate as much pressure. But now you're getting these compensatory mechanisms as a result of that left ventricle failing. And one of the compensatory mechanisms that you're going to get is the Renin-Angiotensin-Aldosterone Mechanism. And that's designed to increase your blood pressure and increase your blood volume. The problem is your kidneys don't know that your left ventricle is in trouble. So as you're going into cardiogenic shock, right, this is making it worse. So, but the kidneys don't know. And what are you going to do, right? So that's going to cause the renin-angiotensin-aldosterone mechanism, and because you're going to be sending blood flow to the most dependent or the most important parts of your body. So what are you going to get? Pale, cyanotic, clammy skin. They're going to lose consciousness. Yeah. They will have low blood pressure. Now, because blood flow is getting cut off to the extremities, at least initially, then their pulse will be weak and rapid. That rapid increase in the pulse is due to sympathetic stimulation. And weak and rapid is referred to as thready pulse. And you put a catheter in them and there's going to be no urine output. So these are the signs and symptoms, or I'm an old nurse, so the new nurses call them the clinical manifestations of shock. And again, this is cardiogenic shock. What happened? The left ventricle failed as a pump. Now, watch. So what's the body going to do? The body's going to make adaptations. They're going to make some changes trying to maintain blood flow to the most important parts of the body, and that's your brain and vital organs. Now, what happened though? We got our buddy, number one, the Renin-Angiotensin-Aldosterone mechanism going up. And I'll simplify here and I'll just tell you. It does two things. It causes vasoconstriction, right? And then it has the effects of aldosterone, right? So, and aldosterone, as you know, you should know this, if we're talking about shock, you should know this, that increases sodium reabsorption in the nephron, in the kidney. And then if sodium's reabsorbed, that's going to increase the amount of water in the blood. It's also going to reduce your urine output because you're drawing that water back into the blood. And what's that going to do if you got more water in the blood? That's going to increase venous return to the heart. And that's going to increase preload. Preload on the heart is the amount of venous blood returning to it. So if there's more blood in the right side of the right side of the heart's fine, right? Nothing having to hit. It's going to pump that blood to the lungs, right? And then it's going to try to get oxygenated and go back to the left side. The left side of the heart is messed up, right? It ain't pumping effectively. So if you can't pump out the blood that you already had, do you want more blood coming back to the left side of the heart? No. So, and if this left ventricle can't generate a lot of force because it's damaged, do you want that left ventricle to pump against arteries that are this big, A, or this big, 2? Hang on, I'll be right back. Okay, so I'm back. I think, hang on. So what do we got here so far? We have 1, sympathetic stimulation. These are compensatory mechanisms, right? Trying to maintain blood flow. Sympathetic stimulation, right? That's going to increase your heart rate and then divert that blood to the parts of the body that need it. Number 2, you're going to get the activation of the Renin-Angiotensin-Aldosterone system or mechanism. And that's going to raise your blood volume and constrict those arteries, right? And it makes sense to do all this stuff if your left ventricle was working good. The problem is that it's not working good. So what's going to happen now is that left ventricle is going to have to try to pump blood through arteries that were once this big that are now this big. And it's going to have to pump more blood because of the effects of aldosterone, raising your blood volume and increasing the amount of venous blood back to the heart. So that's going to make the heart fail even more. So now things start getting bad. So you have the sympathetic stimulation, the Renin-Angiotensin-Aldosterone mechanism in, and now the left ventricle is going to fail even more. So what is that going to do? That's going to cause a decrease in O2 delivery to the cells even more. Then what happens is this. And this is important. And you learn this. So here's a capillary, right? And everything happens at the level of the cell in the capillary, right? And here's the cell. So if there is decreased oxygenation, decreased O2 delivery to the cells, what that means is aerobic metabolism, right? The ability to make ATP aerobically with the oxygen, that's going to dramatically decrease. Your cells don't care. Your cells want ATP. They even say it, I want my ATP. What will happen is you will take glucose and you will break it down to pyruvate. And you can make some ATP that way. That'll keep that sodium-potassium pump in our cells working. And this is what ultimately kills you from shock. But pyruvate starts building up. That's bad for you because it's an acid. So what the cells do is they convert it to lactate or lactic acid and dump it into the blood. So what are you doing? What are you dumping in the blood? Acid. And enzymes inside your cells that control all the chemical reactions inside your cells, they are temperature and pH, acid, pH sensitive. So if you drop your pH by adding acid, because you can't deliver enough oxygen to the cells, then it will jack up your enzymes and metabolism will stop. This is ultimately how you die. The most important thing, and ultimately what leads to cell death, is the interruption of the sodium-potassium pump. You got these pumps in every cell of your body. And what they do is pump. And you'll never guess what they pump. Yep, you got it. Remember that sodium is highly concentrated in the blood, so where does it want to go? It wants to leak in to the cell. Where's potassium highly concentrated? Potassium highly concentrated in the cell, so it wants to leak into the blood. So what keeps the concentration of sodium in the blood high and potassium in the cell high? It's our buddy, our pal, sodium-potassium pump. So it takes 3 sodiums that leaked in through these little ion leak channels, pumps it back out, and 2 potassiums that leaked out through a potassium ion leak channel and pumps it back in. Because you're working against the current, that requires ATP. Right? Now look, what happens? It needs ATP. Where do you get ATP from? You get ATP from metabolism. If you ain't got metabolism working, you're in trouble. If you don't have oxygen, you can't make ATP the best way, and that's your aerobic metabolism. The sodium-potassium pump is ATP dependent. It requires ATP. So in all the cells of your body, especially the cells of your brain, right? You got potassium inside the cell. You got sodium outside the cell. What maintains the concentration of sodium and potassium in the blood in the cell? It's our buddy, our pal, the sodium-potassium pump, but it needs ATP. So if you don't have oxygen and you're dumping acid into the blood, metabolism is controlled by enzymes. The result is that you ain't going to be able to make any ATP. So the sodium will begin to leak in, the potassium will begin to leak out, and what follows sodium by osmosis, so water from the blood will be drawn into the cells, and your cells will explode. And when they explode, that's it. It's over. So that is the end of you. And what people don't understand is that the most sensitive cells of your body to changes in pH and changes in fluid are your brain. Your brain doesn't have a lymphatic system to drain off excess fluid, so if it goes in there, it's stuck there. So when those brain cells explode, they got permanent Dane Bremage. And it is over for them. And then families can't understand, well, gee whiz, you know, they're smiling, they're moving, their eyes are open, they're making sounds. And what you have to explain to them is that, yeah, the lights are on, but nobody's home. And that's the end of the story. So, again, real simply, and I'll do another little video on how you treat cardiogenic shock. But, again, it's the failure of the heart as a pump. The most common cause of cardiogenic shock is myocardial infarct. There are other causes of cardiogenic shock. Let me just show you. I'll write this out real quick. All right, I'm thinking now. MI, valve disease, ruptured, aortic stenosis, cardiac tamponade. Cardiac tamponade, it can cause cardiogenic shock, but it's not really the heart failing as a pump. It's essentially the heart getting squished by either fluid or a lung crushing the ventricles that don't allow it to fill. And then a goofy heart rhythm, arrhythmia. Those are the causes of cardiogenic shock. All right, so I hope that helped, and I'll see you later.